You are welcome to today's video. Bit of news from the United Kingdom first of all, then moving on to the United States. And the kind of headline thing I want to talk about in regards to the United States is that the Centre for Disease Control has recently published that 53 million people in America have probably been exposed to SARS coronavirus 2, way higher than the officially diagnosed figures. But we'll come on to that later, and I also want to talk about the World Health Organization trip they are having to China to investigate the cause of the pandemic, investigating where the virus actually came from. To give you the bottom line on that one, don't hold your breath. Right, let's go into the detail. So United Kingdom, now the R value as a result of the interventions that have been carried out, it looks like pretty certainly now it's just a little bit below 1. So the R value is just a little bit below 1 in the UK. So this means that cases will either be level or falling. And we've got pretty good reason to believe that cases have been reducing now for some time, but this is now being recognised in official data. Now, the UK, the tiered system restrictions in England will be kept in place until a vaccine becomes available. This is now what the government are saying. So obviously we're still in this lockdown in England at the moment till the 2nd of December. But after that, we are going to be under restrictions until this virus goes away as a result of vaccination, or essentially goes away. I believe it will fully go away in a few seasons. Now, there's all sorts of huffing and puffing going on now in Parliament in the United Kingdom about rural areas which often have quite severe restrictions because of a local city which has higher rates of cases. And it's being done basically on a county by county basis in the UK. And MPs are saying, well, no, this village should be in a lower tier because the infections are in this city. That's what they're saying. On the face of it, it sounds good, but in practice, it probably wouldn't work, because if the areas were too small and someone wanted to go to the pub for a drink and the pub next door was shut, but the pub 500 metres away was open, all they'd do is walk to the pub 500 metres away. So people would shop around. Now, county lines can be arbitrary, and of course you get cases of villages that are cut in half and one pub that's open and one pub that's closed. But if you have smaller areas, then people would shop around and spread the virus around with them. And this has been part of the problem in the UK with the delegation of authority to states, to counties and to individual municipalities. So I think these MPs that are complaining about this, while I understand their position, I think they fundamentally misunderstand this concept that people would simply shop around. And the whole point is to stop this kind of spread. So that's the idea behind this counties and the county line sort of thing. Now, Christmas contacts are going to be left to individuals. Seems to be the philosophy. So all these permissions have been given for people to meet up at Christmas, but that doesn't mean you have to. Now, I was actually talking to a bloke today, and he was umming and ahhing about his elderly parents bringing them round for Christmas, and I said, well, do you want to play Russian roulette with their lives? You know, that's basically what this is about. And I think the message got through. So because we are allowed to do things doesn't mean to say we should do things. In fact, there's pretty good reasons why we shouldn't be doing a lot of these things at Christmas, because even with the restrictions, well, the restrictions are lifted now for Christmas. Many restrictions are lifted for this 5-day period, longer in Ireland. And this will cause more cases. There will be a surge in January, depending on how many people take up the freedoms that have been given for that time period. I still disagree with it, but it's what the government have decided. So let's hope people are going to be sensible. Northern Ireland starting a 2-week circuit breaker from today. Northern Ireland tends to get quite a lot of press, but bear in mind there's only 1.9 million people actually in Northern Ireland. So compared to the rest of the UK, not a large population. If you haven't been there, it's a remarkably beautiful area, as is the Republic of Ireland, and a lot of it is very rural, therefore the population is quite low. Now, regulators to assess the Oxford AstraZeneca vaccine. Now, again, there's been all sorts of huffing and puffing about this in the press, and I must say I find it slightly irritating. So what happened was that there was 3,000 or 4,000 people got 25 billion 25 billion viral particles as a dose, which is half the dose they should have got. And it seems they did much better than the people that got the full dose as the initial dose. So as a result of this, there's 30,000 people in a trial now being recruited in the United States, and they're going to get the half dose to begin with, and the full dose for the second dose. And I would imagine some will be getting the half dose twice to see what the efficacy is, and we don't know. But the lowest efficacy rate was 62%. The average was 70 and the highest was 90. Now, the World Health Organization experts are happy with an efficacy of 50%. It's worth doing. And the point is that no one who had the Oxford AstraZeneca vaccine went to hospital. None. No one got very sick. So arguing about cases that don't result in hospitalisation, to me, is somewhat of an irrelevance. If people get a virus and it goes away, then that's okay. It's people getting sick or people getting long COVID that we want to worry about. And we don't know about the long COVID data yet in terms of vaccination. But we do know that the people that got the Oxford AstraZeneca vaccine didn't get very sick and weren't hospitalised. And we do know that the safety profile is good. Suffice it to say, if I was offered the Oxford vaccine now, I would roll my sleeve up and have it without hesitation. So I do hope that this is going to be approved without worrying too much about what really is detail. This will become obvious as more people are vaccinated, and as long as it's safe, that's really all that matters. If it works, then so much the better. And the lowest value for efficacy is a 62% protection. So that's pretty good, and it could be as high as 90%. So quite why people are puffing about this as much, I really don't know. And Matt Hancock agrees with me, it would appear. So the government has asked the Medicines Healthcare Products Regulatory Agency. They will say yes or no to the vaccine. It is their shout, and Matt Hancock has said, get a chivvy on, lads, get on with this, in nice language, but that's what he's basically said. He's saying, come on lads, get on with this, we want this sorted. And on this occasion I emphatically agree with Matt Hancock and would certainly have it myself based on the safety data we know of, and I would be happy for members of my family to have it as well, based on the safety data we understand and the efficacy rates that are on offer. And if it turns out you need a booster in a year's time, then not the end of the world, is it? It's not as if I haven't had vaccine boosters before. I had a tetanus last year or the year before, was it? You just get boosters from time to time. It's just the way it is. Now, 2020, 4 million doses can be shipped out to the UK of the Oxford AstraZeneca. That's enough for 2 million people, of course. Nice start for 2020. By March 2021, again thinking about the Oxford AstraZeneca vaccine, 20 million people could be vaccinated. Let's get on with this would be my suggestion. And Matt Hancock clearly agrees. In addition, 40 million doses of the Pfizer BioNTech vaccine. So these are in hand, of course, but we are getting these in 2021. Not quite sure when in 2021. But of course this needs the cold chain, massively cold chain. It has to be shipped in dry ice. Whereas the Oxford AstraZeneca vaccine, you can just put it in a cool box, put in a couple of iced blocks and go off and do your rounds for the day. Very, very low tech, exactly as we're used to doing, in fact, as I've done many, many times with other vaccines. So AstraZeneca did say it's amending their study in the US to check on the lower dose, 25 billion viral particles as opposed to 50 billion viral particles. Now, it could be that with larger numbers, this effect of being much more efficacious with the lower first dose simply disappears, because the numbers of people actually infected are currently quite low. But even if, as I said before, if it's as low as 62%, that is a good start. So hopefully they will progress with that. Now, moving on to the United States now. Cases, well, that was the last full 24 hours in increasing cases, 182,000 diagnosed cases. These are tested cases. This was on Wednesday. I think that was the full data for Wednesday. So basically 13 million cases formally diagnosed. I haven't put the link on there, sorry about that. I'll check on that. But 53 million infections so far in the United States according to the CDC data. So 12 million, 13 million diagnosed, 53 million the real number. So clearly for every case diagnosed, there are several cases not being diagnosed, whatever 13 into 53 is, so it's about 4 or 5 or something. Anyway, so the real number is much higher. Total population in the United States, 33 million from memory, about 330 million from memory. So we can see that actually that means that there's still 280 million people in the United States still susceptible to the virus. That means in terms of natural evolution, without the vaccine, we're only a little bit of the way through this pandemic in the United States. So roughly exposure, just over 50 million, 280 million still susceptible to the virus. The vast majority of the population still susceptible to the virus. The evolution of these things takes time, but the vaccines will intervene. Deaths, again, this is Wednesday data, 2,284 COVID-related deaths, taking the number up well over 250,000, as we know. And this was the highest daily figure since the 7th of May. And Dr. Fauci estimates that we're going to add 43,000 to this number by Christmas. Another 43,000 more deaths by Christmas. And a lot of these are already baked in to the increase in cases. Because of this 182,573 that were diagnosed on Wednesday, some will unfortunately inevitably die. Hospitalised people in the States now, well over 90,000 actually in hospital at the moment. Now, some areas are massively struggling, other areas aren't so bad. But this is putting strain on health facilities in quite a few areas now in the United States, and it's getting really quite serious as infections continue to increase quite dramatically in the United States. California and Texas recorded their highest single-day counts to date. I put those in because, of course, these are the more populated states. So we're talking about large numbers. We did look at North Dakota a couple of days ago, but I don't know what the population of North Dakota is, but I know it's a lot lower than Texas and California. So bigger numbers coming as more populous states are also having a more significant increase in cases. 1.1 million, that's the 1.1 million people went through airport security checkpoints on Wednesday. 1.1 million people. Now, to be fair, last year it was 2.6 million on the same day. But that's still the highest number of people going through airport security in the United States since March. So 1.1 million people in the States on Wednesday were flying. That's a lot of people. And the American Automobile Association, 50 million on the move by the end of the weekend. And it's people travelling from one part of the country to the other that is the most concerning thing here. So what this virus would really like is for people in an area where there's a relatively high prevalence who are carrying the virus asymptomatically to get in the cars, to get on a bus, to get on a train, to get on an aeroplane, fly to a different part of the country where the amount of infections are lower. The virus would then likely to shut the doors, keep nice and warm inside, be with others who are uninfected so that you infect them in an indoor warmed environment with relatively poor ventilation. The virus would also like you to chuck in a bit of alcohol, a bit of hugs and just normal family intimacy, which of course is brilliant at the best normally, but at the moment it is exactly what the virus wants, and there will be a great surge in the States as a result of this. I predict that clearly. That is going to happen. Decisions have been made, and those decisions will have consequences. Now, Robert Redfield, boss of CDC, of course, Centers for Disease Control, he concurs. Household gatherings are fueling the latest surge in coronavirus cases. So why are cases going up in the United States so dramatically? What is the main driver of infection? Indoor household meetings. Household gatherings are the main gatherings between different households, whether they're in the same family or not, the virus doesn't care. That is what's driving infection in the United States at the moment, the main single driver. Therefore, that is the thing that needs to be reduced to get the numbers down, and that's exactly what has happened. Now, to be fair, I know I'm preaching to the converted here, because so many of you have written in and said, I'm making this sacrifice this Thanksgiving, and you have my admiration for that, and I acknowledge that tens of hundreds of millions of people, tens of millions of people certainly, made significant sacrifices, but in doing so you protected members of your family and prevented the ongoing spread of the pandemic. So you've done the right thing. But there again, if you didn't care, you probably wouldn't be watching this video in the first place. What we really need to be getting to is the people that don't watch this video, or indeed any other such communication. They're the ones we really need to communicate with. So that's up to you as individuals to do that, I'm afraid. But try not to get into any fights. COVID-19 vaccine rollout will start in the second week of December, according to Robert Redford. Sounds like he knows something, folks. Second week of December. Food and Drug Administration Committee looks like they're making the announcement on the 10th of December. That will be the no-go for the vaccine. And I strongly suspect, given the data we've got, it will be a go. It will be a go for the Pfizer vaccine. Therefore, on the 11th of December, 6.4 million doses will be shipped out. That is going to be, so this is probably going to happen on the 11th of December. 11th December. In the States, you write it the other way around. We would write it the 11th of the 12th, whereas I think you would write the 12th of the 11th. Anyway, excuse me, I digress. And anyway, where are we? 40 million doses this year, mostly Pfizer vaccine, but that's good. Health and Human Services, who seem to be involved in the logistics, as well as the drug companies themselves. So federal agencies and the drug companies, the vaccine companies themselves, involved in the logistics, but the states will have the final say on how they distribute the vaccine within their state. So it's going to be a state-based decision. Right, now, we haven't done Russia for a while, just a little bit on Russia. Cases in Russia are hard to diagnose, so to say that's an underestimate is a underestimated statement. The numbers are way higher than this because it's very hard to be diagnosed. Deaths, who knows in Russia? That's the minimum again. Now the Russians lately haven't gone for a full lockdown. They've gone for targeted regional interventions. Now, in this case, in that you could say they're much the same as the UK in that regard, and it is a strategy I agree with. So, targeting particular areas for increased restriction seems to be the Russian approach. That makes sense. That makes sense. It would just be interesting to know what these figures were in actuality, because they are underestimates. They plan to vaccinate 400,000 military personnel. 2,500 have been vaccinated already, presumably with the Sputnik V, the Sputnik vaccine. They plan on vaccinating another 80,000 by the end of the year. Quite impressive. Now, this is very interesting. Now, we haven't been told this, but this is just the Russian authorities giving out little dribs and drabs of information here. We assume they're talking about the Sputnik V vaccine, the Russian vaccine. Now, the military, they've said, are going to need the first 2 shots, fair enough, presumably 3-4 weeks apart, probably 4 weeks apart. Then they're going to need a third booster at 6 to 10 months, they're saying, and then a booster every 3 years. That's the first time we have seen such a schedule published. Well, the first time I've seen such a schedule published, so interesting. Will this be true for other vaccines? Well, of course, at the moment we don't know. Is this a manageable schedule? Yes, it is. This can be done. So that's what it's looking like. 2 shots for the Russian vaccine, then another one 6 to 10 months later, then every 3 years. And I would hope within 3 years, or certainly 6 years, this virus will have gone away. And the Vector Institute that's making these vaccines in Russia apparently has got pretty limited manufacturing capacity. Now, I forget what the population of Russia is off the cuff. I think it's about 130 million, is it? Something like that. So clearly they can't make anything like enough vaccines for themselves, although they are working on other vaccines which they might be able to produce more of. But I know that the Russians are very interested in acquiring stocks of the Oxford AstraZeneca vaccine. All the more reason to get on with it, so we can help people in Russia to protect themselves against this disease. And of course, it's way cheaper than the 2 messenger RNA based vaccines, which we have data for already. Now Africa. It was looking good for South Africa. Had difficulties, of course, but it was looking good for a lot of Africa. Almost like they got away with it, but cases do seem to be increasing in Kenya, despite its remarkably young demographic. So they do seem to be increasing. Data is very hard to get. Official case is 80,000, which is nonsense. It's way more than that. Official deaths is going to be higher than that. Population's 51 million, and the testing 7,000 tests per day. So 7,000 tests per day over 51 million people. Very, very remarkably low level of testing. And given that this is the number of cases that have been diagnosed after testing, we can assume it is a massive underestimate. So that's what we know about Kenya, and it just means that basically we don't know anything about Kenya, and indeed by implication many other sub-Saharan African countries. But we do believe that cases are rising generally in Africa and in Kenya. Now, Kenya have reduced wedding guests from 100 down to 50, funerals down to 100 people to attend a funeral, 15 at the graveside. So clearly not exactly draconian restrictions, but weddings and funerals especially, are massively important in Kenyan culture. So not an insignificant step for the Kenyan government to take, but still nothing like the sort of tiers and restrictions we're facing in the UK, for example. Serving food to guests is banned at weddings. Church services can only last for 90 minutes. You have to admire people. They do have long church services in Kenya, but these are limited to 90 minutes. The key thing about church services in Kenya is not the length of the service, it's how well ventilated the building is. So if you are in Kenya yourself, or you have any contacts in Kenya, and it's not that cold there, okay, it's going to be coolish now in the highlands round about the what do you call that city? I've forgotten it. Mombasa's by the coast. Nairobi, of course. round about Nairobi, it might be getting a bit cool, but you can still open the window. So ventilation is going to be the key thing for church services. And to be quite honest, I would advise against singing for the time being. If you want to sing, do so by all means, but go outdoors and do it at a good social distance. Now, where this virus came from, I suspect we're never going to find out. Let's look at it. The team of 10. So this is the team of 10 scientists appointed by the World Health Organization to trace where the heck SARS coronavirus 2 came from. They're from the World Health Organization. Now, the World Health Organization, some would say it's lost all credibility. Some would say the leadership needs to change immediately, appointing David Nabarro as the head of the World Health Organization immediately. Some would say that. But having said that, the quality of the people in this team, and I have looked through the list, it is a genuinely distinguished team of international experts. So the expertise is there. They're going to travel to Wuhan ASAP. Though quite when that will be, we don't know. So the quality of the team, for example, England's former Deputy Chief Medical Officer and the other people, international team, all virologists, virus hunters, public health experts, animal health experts. These are serious boffins, proper scientists that are going to be tasked with this work. From the UK, United States, Australia, Denmark, Netherlands, Japan, Qatar, Germany, Vietnam and Russia. So genuine international team. They're going to work with Chinese experts. Now the people in this team have been individually given permission to go to China by the Chinese authorities. But having said that, they are genuine serious scientists. Working with Chinese experts, there is no shortage of expertise in China, that is for sure. This is a World Health Organization priority research area, as a direct quote. Now, they did go in February. There was a scouting mission that didn't visit Wuhan. I remember expressing dissatisfaction with this scouting group at the time. Anyway, the team has been finalised in consultation with Beijing last month. So, in consultation with the Chinese. Make of that what you will. But the going, that's the main thing. They've been in regular contact, Zoom and stuff, from the 30th of October, so this is happening. All right, Mike Ryan, Head of Emergencies at the World Health Organization. Direct quote, "We need to start where we found the first case, and that is in Wuhan in China." Okay, reasonable. "And then we need to follow the evidence after that, wherever that leads." That's one of our sayings, isn't it? That's one of our sayings. But seriously, let's hope that does happen. And apparently they are going to have access to the Wuhan Institute of Virology. So that is encouraging, but of course this virus did start quite a long time ago now. They are saying it's a riddle that can take years to solve. Sounds a bit like, what do you call that? Expectation management. That's the phrase, isn't it? Expectation management. Now, MERS, Middle East Respiratory Syndrome, was traced to camels after a year. SARS to bats in a cave in southern China, Yunnan province, took a bit longer. Let's not get downers on bats. They're part of the ecosystem. The problem is not bats. The problem is the way that people interact with the animals that the bats interact with. And basically we've got to stop eating wild animals. There's no need to. How to prevent infections with SARS coronavirus 2 in animals and humans needs to be learnt. We agree with that. Prevent the establishment of new zoonotic reservoirs. We agree with that. But even if there are zoonotic reservoirs, if humans change their behaviour, this won't be a problem. Because there's untold billions, trillions of viruses out there in animal reservoirs and ecological reservoirs. It's how we interact with those that is the problem. not so much the existence of the virus, but us giving them the opportunity to jump into humans. But the World Health Organization do say, of course, they want to prevent spillover infections, obviously. They state the obvious. Now, last thing, people used to send me in quite a lot of pictures, so I think it would be quite interesting to have a few pictures that document the pandemic in your area. So if you're out and about and you see something that kind of illustrates the pandemic, and it's appropriate to do so, then take a picture and send it to me, and we'll play them, and we'll try and make a bit of a collection of that. That's the email, campbellteaching@hotmail.com. Now, do not send me in other people's pictures that are copyright. Do not send me in pictures from press that are already published. Do not send me in pictures that our copyright is owned by any agency or press outlet, because I can't use them. And it's sometimes hard to tell the difference, so please don't do that. But any pictures you take yourself that illustrate the pandemic would be interesting. I think it would be good to to just collect a bit of a record of that, the way the pandemic is unfolding in different countries. Okay, that is us for today. It's going to be a difficult winter for some of us, I'm afraid, and the vaccines will start making a difference in next year, April time probably. Start noticing the difference. Until then, we need to follow all of the basic precautions that I think most of us know fairly well now. Hands, face, space. Don't forget to ventilate, and do consider your vitamin D status. Thank you for watching, as always.